you can clearly see where my head was. You see? So this is the layers. Normally, if the patient already give the botulinum toxins and the patient still complain, okay doctor, I still can see some lines around here. Normally, I'm gonna help with this kind of things using the profile on the prostate because it's gonna help by a lot. So on the subcutaneous layer, it's gonna glide easily, so you don't have to worry about it. So for the total temporals and the forehead, normally I use at least 1 cc for each side. Is there any questions? While I'm doing the other part, if you have any questions, it's okay.
Okay, we have one question from the floor.
Hello, my name is dr.Adiwirya from Batam. According to what I see, the right side of the frontal is how to make sure if the profile becomes regular, to how to prevent the irregularities of the profile.
Okay, it's almost impossible for the profiler to create irregularities since the tan delta from the profiler is so high. So even though, okay, you can see the irregularities now, normally in the 4 until 6 hours, the irregularities are almost completely gone. It's quite different when we are using a sharp needle and we do inject it intradermally. Yes, the bumps normally gonna stay at 1 until 3 days if we inject it using a sharp needle intradermally. But since we are injecting into the subcutaneous layers, it's much more easier to spread. So the irregularities won't last until a day. It's normally 4 to 6 hours.
Is this one? Yeah. Okay. So we need this patient to improve a little bit of the projection of the angle. It means that. And the other thing is to go to the third step, that is the chin. What happened here with the chin? He has a really good chin, but it's way too rounded. And I wanna make it more square because you know that in men's it is important to be more defined when we are talking about features. So I'm gonna improve this square chin. And I'm gonna use here cannula in the chin, cannula for the angle, for the branches, and needle for these points that I'm gonna inject in the middle there. So maybe you can rest again. And I'm gonna start cleaning again my patient. I'm gonna be cleaning a lot. So I don't try to erase every of the lines that I draw, but I always clean the area where I know that I'm gonna be injecting. So the first product that I'm gonna use, I wanna take this on my hand. The first product that I'm gonna use is Intense. Okay. And I'm gonna use a needle. The needle is 70. We are supposed to use with this Nubia filler. This is a pegylated filler. I will need to make some extrusion force to take the product outside. So we use sometimes as something to make it more secure. But well, let's wait because here I don't have it, but this is perfect. So I'm gonna inject supraperiosteum. I'm gonna start here. I'm gonna clean. You're gonna see that with these just few points, the result is gonna be perfect. Breathe. I'm over the bone. It is important that I feel the bone. And now I'm aspirating. You see, there's a bubble there. Wait from 5 to 6 seconds. prefer to aspirate when I'm injecting with needle. I feel more secure. There's a lot of articles that said that maybe wouldn't work, but for me it's good. And now I'm gonna improve a little bit more his zygomatic arch to make it more defined, more sharp.
Ricardo, how much did you put in for the first point?
I use just 0.2 milliliters in the first point. The second point I'm gonna use just 0.1. And I see. Oh, it's perfect. Let me see. Ah, maybe with a ghost for me. Yeah, try ghost. Yeah, perfect. Let me see. Look at me. It's going perfect. I'm gonna show you when I finish this part. The result. 0.1 again. That's all. Now, as I have the product with the needle, there's another way to treat the shin, that is cannula or needle. I prefer to use both. If I want more projection in the shin, I prefer to use needle to make more projection when I'm treating the lateral and or when I'm trying to make it more anterior. But as I saw this, the shin of my patients, I wanted to be more square. So I'm gonna inject here over the bone just 0.1 and 0.1, and then I'm gonna use cannula. So let me go over here. You're gonna feel a lot of pressure, maybe a little bit of pressure because the shin doesn't expand as well. Obviously, I'm gonna make some aspiration. You know that it's a risk area. I mean, every area of the face could be considered a risk area. So that's why I always try to inject slow. I'm not gonna treat the other side because I'm gonna do it at the end. And now I'm gonna use a stimulant with a cannula. Don't worry, help me. Exactly. Don't worry. Perfect. I'm gonna put the cannula here. So I'm gonna use a syringe that is the 21 syringe that came in the box of the product, just to make the entry point. Is this the 21? Yeah, probably. Yeah, this is. I'm gonna do one entry point to treat the ankle. I'm gonna going over the edge. So I clean really well. I don't need to go deeper because I'm just gonna go there in this area. Make this point. But I'm gonna make another point in the middle of the shin because I'm gonna use a technique for the shin to make it wider and more square. Deep breathe. So now, I'm gonna inject the stimulant. A stimulant is a hybrid. So, why I prefer to do a stimulant on the inferior third is because I need more collagen. Can I have a dry dose? A stimulant is a hybrid that has a collagen biostimulator, so that will be perfect for the inferior third of the face. And most if our patient is not that young as we think, and we know that he will improve with collagen biostimulators. I'm gonna go here, and I'm gonna go posterior. First, I'm gonna make a bolus. I don't know if you can see. Maybe here, a little bit more natural. Maybe you can like here, because I don't know if it's clear. Well, here I'm moving my cannula You can see the shape of the cannula, but not the color, so you know that I'm not superficial. It is important to have it clear because stimuli has a really good reticulation, so I don't want it to be way too superficial to maintain like a shape of the product or that is noticeable. I want it to look really natural. So I put a bolus of 0.2 milliliters. Slow. And then I made some vectors to enhance what the product is. I'm gonna go a little bit down. It's like I'm doing a work of art. Here is when art is important in aesthetic medicine because we have to know what is good for our patients. It is important to know also that when we are performing masculinization, most of our patients are gonna need to shave this area if they wanna see some changes, no? You know, because we make up with the beard. Okay, and then I'm gonna go with this point that I already did in the chin.
So how much did you put in with the cannula?
With the vectors, I put 0.3, so I put almost 0.05 milliliters per vector. It's like drawing, like I'm trying to draw what my patients think. Let me see. It's over here. Great. And then I'm gonna go lateral. Why? Because I want it more square. But I use this point because it's just one. My patient is gonna be a little more comfortable. But you probably will see that this area is not that easy to go, so you have to do it slow. You have to build the product. Perfect. I'm gonna move my cannula to see if I'm not superficial. If I'm way too superficial, I'm gonna have like wrinkles on the skin. Here is a perfect plane. I'm feeling the cannula. Never inject without feeling where is the tip of my cannula. And then I start to do another box, 0.2 again. I think I'm gonna finish at the end, the other side. Do we have time now? I don't know.
Very great.
All I was
Is
trying
it the
to-
last point of your pentagon?
Yeah.
So which plane are you right now?
Up there.
Subdermal,
As you can
but
see.
deep, right?
Yeah,
So you don't
exactly.
have it. It's very nice.
It doesn't matter if I go superficial really because stimuli integrates a lot with the skin. And I just wanna make something extremely natural to him because we already talked and he said, and we talk about expectations, which is important when we are injecting our patients, not what the patient wants. So with this, that we inject around 1.5 milliliters, I have half of the face. I wanna see, you can see it, please. So let's move right here. So we can see that the product, now we have this angle, the mandibula. This middle tear is natural, it doesn't look overfilled or something. And we have, you can turn, a little bit more the projection of the chin. Now we have to perform the other side to improve. Maybe in men it's important to do both sides because now then we are gonna have like asymmetries or intensify the asymmetries, but now when I perform the second side of the face, it will be perfect and then we will show you.
Thank you so much, Ricardo, for
Thanks
this
to you.
presentation. So now we have seen two masculinization, and I think we have to see one more, and I'm very happy to announce the next speaker. And this will be the ISWAM president from Ecuador. His name is Yusuf Moran, and I'm very happy to see you up the stage, my friend.
Then we have our patient. The result in this patient is amazing. Was amazing. Was amazing. All we saw, okay, improve the chin, the head drop, the mandibular upper, and nasolabial fold. Okay, the video is very long, so I need to change the diapositive. This is the result. Okay, you can see the result in my consultory.
Tiduran.
Hello, sorry.
Halo, Zara.
Oh my God, my friend is sleeping.
Sleeping handsome.
Good morning.
It's a jet lag from Ecuador.
Yeah, in Ecuador is
Dia jangan jalan-jalan.
4 a.m. in Ecuador. In this case, for older patients, you can use new technique.
Oh yeah.
We can use two types of hyaluronic acid. The first type is for hydration, and the two type is for voluminize. Okay? Maybe you can try it out. Maybe you can tell me, put it up. Put it up. Okay, I first apply to the hyaluronic acid for hydration in fan shaped. I mark to the entry point, okay, in the cheekbone, okay. I have a point in this zone and mark to the a little line. This combination is perfect because, for example, if any patient you come to always in the consultory, maybe each 3 or 4 or 5 months, you can apply different technique of masculinization, facial masculinization. Okay, this is the line for the apply to the hydration for infinite filler L, right? S and M. S, okay. I use S and mark to the mandibular angle. The cheek of my father's cheek is very heavy. Okay, I apply a little bolus in the tuberculous. Okay. And apply a little bolus with cannula in the nasolabial fold and nasolabial fold. I can mark to the line. Perfect. In the any doctor have many techniques for the facial masculinization. For example, Ricardo has the pentagonal technique. Other famous doctor in Colombia has a lion face. This is other technique. Maybe you combine to the hyaluronic acid with hydration and voluminized hydrogen acid. I need to the needle for entry point 21. One needle. Okay. To the entry point. Okay, perfect. Yes, can you? 25. Okay, I'm ready to the. This is a infinite S with lidocaine. I'm in the entry point. I direct toward to pyrophore 4. Okay. It's very important this technique make to the fan shape, okay? To the mark this line. The quality of the steam of my father is very well because I apply in Ecuador. It's 2 months hyaluronic acid for hydration. Obviously, inferior. Can you please do the needle? 21 needle. Okay. Then I make to the other entry point in the middle of the mandibular angle. Here you can see, right? Okay. Do you remember that it's only hydration filler? This signified shape is for improve to the megalolial fold. Perfect. Okay. Maybe we can do another N or S. Fine. This is the last setting for the S. Thank you so much. Okay. Then I'm introduced to the cannula. Then toward to the nasolabial fold. And do the mandibular angle. Perfect. Okay. Give me the Excel. Then I'm apply the last filler is the infinite filler XL. I need a new cannula, please. when I apply to the hyaluronic acid XL, inhibitor XL, I'm starting again with the mandibular angle and put a 0.55 in the mandibular angle with the cannula, then apply the rest with the needle. When the patient has the jaw, you can use the cannula for the chin, maybe in this way, and apply to the hyaluronic acid neonatal injection for define the mandibular line. Give me another one, please. Exhale. Ahora vamos a hacer. I'm sorry, I speak Spanish. I'm sorry. A needle, please. 27, a needle. In this case, for my father, I applied to hyaluronic acid with a needle, not with cannula, because the chin of my father is very heavy. It's a perfect. It's not. It's too large. Maybe a small needle. Yeah. Yeah. This is a perfect. I think it's okay. Thank you so much, my friend. Okay. Okay. This is the last video for XL. Okay. I'm applying to hyaluronic acid in two planes, deep plane and superficial plane, for the making the chin. This technique is in fan shape too. Okay? With the rest hyaluronic acid glycerin, I can apply a little bolus in the nasolabial fold. In the mentolabial fold. And I finish the cheekbone. One, two, and three bolus. Sorry. I do a little massage. And the rest I into the setting. Okay. Después se me pasa un ratito para que podamos ver. Maybe you can see the result. Yes, thank you so much. Improve the mandibular angle and the mandibular line, and much better projection in the chin. and the nasolabial wall. The other side.
Yes, you can definitely see that. So, thank you for your way of doing your masculinization.
Thank you for your attention.
And thank you everybody, a grand hand of applause. Thank you. Our next speaker, and
I need the boxes. One box of this. I deposit. What we have to know in this area. In our zygomatic arch, it's relative safe, okay? But if we go under or the infraorbitary zone, okay, or in the malar area, we have to take care of some structures like the artery and the nerve infraorbitalis. If we work with the jaw line, we must know where are the facial artery, and don't forget the vein. Okay? Now I'm going to teach you how we can a few tricks about to select the point of entry so we cannot touch that arteries. Okay, then we can treat too with cannula the nasal fold. There is a different techniques. I use this one, always subcutaneous. Okay, here we have to be careful with the angular artery, and then if we can go to of the same point to the malar area, and that's what I told you a few minutes, that we have to be careful of the arteries in that area, okay? Like I'm showing you, there is different techniques. I'm going to try to combine a little of each one, so we can learn more. I want to show you this. Wait, I don't see. This is our angular. Then we have superior labial, and they go to the nose too. Okay? It's a big artery, so we have to be careful in that area when we are injecting. Now, the marionette line, okay, that we have the entry point. I like to do it like we were seeing, backwards, and a small bolus or a small milligram of product, maybe 0.005 each line, and we can go to do the chin too. And when we're going to treat the chin, we have to be careful with the mental artery, okay, and the submental artery too. So that's the reason that we have to learn about anatomy. The time is too short, so I can explain all of anatomy. I try to put like the basic stuff, but I like in other presentation, I always take maybe 1 hour, 2 hours to explain all about anatomy and anastomosis, connections, but for this, it's going to be fine. Then, we have to do with our patient the planning. So, this is my patient with her, wait, This is our planning, very important. Okay, we treat the temporal, the zygomatic arch, nasolabial fold, the malar area, jaw contouring, and a marionette line and the chin. There you see the three kind of products that I use. Okay, and now we were going to do it here, and when I'm doing it, I'm going to tell you which product I'm using right now. Okay, and this, you have the results, very natural, very nice. The patient was very happy. You can see, no, this doesn't work here. You can see the jawline. We improve it. Okay, the nasal fold disappear, no more. We elevate our cheek structure, and in here I didn't inject in the tear trough, only treating the malar area. Okay. Thanks. This is the theory part. You have to come to Machu Picchu and okay. First, who can tell me right now what is wrong if I want to do my planning? What is wrong right now? Everyone can participate. Okay? Anyone can want to say something? Why right now, if I do my planning, okay, if I want to mark her face, it's wrong right now. It's about the patient, not me. Anyone? Yeah. The patient always have to be sit or stand. So you will be sitting. That's the real face. You have here. Okay. She has more rounded face, so what we want to do is, with a cannula, make a little deposit in the zygomatic arch to do a lifting and contouring this area. Okay? So, where we are going to put our entry point. You can do this, everyone, if you want. Feel the lateral external zygomatic arc. Okay, everybody, let's do it. Everybody, let's do it. Come on, feel it, okay? And you have your limit, your superior limit of the bone, and the inferior in the zygomatic arc lateral external. Okay? And in the middle, we are going to do our point, entry point. This is a safety area, okay? And we're going to do, you can see, she has not the projection of the malar area, so we're going to treat this area too. Okay. We can go over here and treat all zygomatic arc, and if you want more contouring, you go lower. Okay. And we can treat the malar area with the entry point of the nasolabial fold. So we're going to put here. Okay, we have to take care about the artery. Which artery? Which artery? Don't be shy. It's for everything it's for everyone to learn the angular artery. Okay. Now His temples are fine. Now I want to feel his gonion, okay? I'm feeling his gonion. I'm going to mark this area and I'm going to show you a little trick. Wait, here. Can you see everybody? Okay. This is I feeling the gonion, okay, the bone. I'm going half of centimeter forward, okay, and I'm going to do another bolus over here, okay, and we're going here like this. We're going to treat this area. Look, this depression. We're going to correct this, and I'm going to try to do only 1 point to treat the marionette line. Okay? And always some question that the people or the doctors ask me is which will be our limit for our jawline. So it will be always the earlobe. So right. This is our and we're going to make a little triangle over there and we fill it this area too. Okay? Perfect. And we will see where we're going to start. She has a rounded face, so I will not use a high density product. I don't want that. I want to make the lift effect without giving her too much volume. So I will inject right now. I will inject with L. We have lidocaine first. Okay. 10 minutos for 2 sides, but I'm the last one. Huh? You are going to give me 2 hours, don't worry. Lidocaine you have? No, yeah, don't worry. Give me the L, yeah. And where is the needle? Here. And we need alcohol. I want to mark. Wait. We have to change the XL for the 22G cannula. You have 22, no, here, 22 is this one, the XL, yeah, with 22, changed, okay? Alcohol, open one, yes please. This is without epinephrine, right? Okay, yeah, lidocaine, you can put here, okay? Put it there, this is all. And alcohol, you have alcohol? Okay, now you can sit. I'm going to clean a little. She's not with anesthesia, they are preparing me the lidocaine, but I'm going to try without lidocaine. We're going needle, just the tip of the needle. It hurts? Nothing? Okay, no lidocaine from here, from here, okay. Now, a little? No. Okay, we're going with our cannula. Remember, the Infinite Products fillers have lidocaine inside. It's more comfortable. Now I'm going in subcutaneous deep plane. My cannula doesn't see. Okay, I'm in the malaria, and I want to put a little bolus over here. No, I need 22 or 21 or 21. Change everything. Give me 21. Yeah, with 22. Okay, yeah. That will be fine all the time. Okay. I have to change the number of cannula. Any hurts? Any pain? Okay, I'm going to put a little. If you have 22 or 21, it's fine. You can put a XL with 21. Okay, with 22. An XL, yeah, with 21. I'm doing a small bolus, maybe 0.05. 0.05. Now backward. Backward. Slowly, and I'm going to put a little more, a little bonus. Okay, not all the syringe. We put like 0.7. To do a little massage. Now I need the Infinite Filler M. It's softer, so I will need the M. We can do it with this cannula is fine. 25, yeah, it's fine. This is M, right? Okay. That we have less, we're going to do it to the other side later. Okay. Can you give me a needle? Yeah. Another entry point. Sometimes the lidocaine hurts more than doing like this. Only just. That's it. Remember, the product has lidocaine inside. I feel my cannula, I don't see it, but I feel the tip. Okay. I'm going to put a little. Maybe tree, and I'm going to do it parallelly. That hurts a little. So, you feel fine? Yes? Okay. Your face. In this case, less is more. Now we can treat a different technique to the marionette lines. Look what I'm going to do. We can go, this hurts a little, okay? Okay. Small lines, 0.1, we're going to below area, and then we're going to combine with another technique. I'm in subcutaneous plane. Okay. Now we're going to do a little massage. Perfect. And now I'm going to use the XL. Okay. Is the highest one? It's have, this is 21, right? The calcula? Or 22? Okay. And it's the most, it have the most reticulation. Yeah, it's fine. Let me mark my cannula. This is 21. Let me see. No, it's okay. Give me this. This is the last. Okay. I need. Sit please a little. You remember I told you I'm going to show you some tricks? Okay. I'm going to tell her to bite a little. Bite? Yeah, like that. Hard. I feel the masseter muscle, and in the anterior area, I touch this area in the muscle. Now relax. Now I can feel the artery. Okay? It's here. So I will not do my point entry over here. You can do it and you will feel it. And one more trick is bite again, please. This is the massetero's muscle, and in the upper side, in this area, we will have the transversal or zygomatic artery, but that artery is like very, very deep, supraperiostic. So if you work in the face in subcutaneous plane, in some areas deep and some areas more superficial, depends of the anatomy, you will not have problems. See? I will do bite. Don't bite. Here I feel the artery. Okay? Sit. No, no, no. And another trick is this. And we are going deep subcutaneous, okay? I'm touching with my other finger the gonium, right? But I told you later, early, that you have to half a centimeter backwards of the gonium. We're going to look my hand. We're going to rotate our hand. You see, I'm not like this, I'm going to do this. Okay, I'm going to put 0.2 here. Very slowly. Always your 2 fingers is for more safe. Then I'm going to the gonium. I'm going to put maybe 0.2. Okay, and I'm going to start doing backwards. 0.1. In this area, we have to be careful with the parotid or parotidia.
2 minutes.
Okay. Give me one more Excel. Do you have one more Excel?
Okay, I think they just turned out the monitors. Please finish up with the last.
The last one. This is the last one. 1 minute, please. 21. The same point entry. Okay. This maybe helps a little. Do you remember she had a depression over here? We are correcting that. Can you give me another with alcohol, please? Can you have one M? Can we have 1 more minute?
I think time is up.
Huh?
Time is over.
Okay. No, but
So maybe you can continue, but maybe you can sit your patient up
okay, no,
to
no
see
worry.
the one side, and then we have
Okay,
a
sit.
short
I want to see. Look,
discussion.
the middle face, look, the zygomatic arc, very natural. We have all lips, contouring size, and look the nasolabial fold compared with this area. Remember the malar, it had the depression, now doesn't have, and no definition, and look this depression, and now she have a good jawline, and no bruises. Let me see.
You can see definitely
Wait,
the change.
put it in the.
And on the left side, you can see the lifting effect. It's very good to see.
Very natural, very nice. And turn the other side. Turn your.
You can see a wonderful jawline compared to the other side. Ramzi, we have to get you from the patient. You can do and continue everything on
Okay,
stage.
no, we're already finished.
I invite you to come and sit. Thank you
Okay,
for your
we're ready to
attention
finish.
and your patience. Thank you, Ramzi. Have a seat with us, and I will just give you just two